So we just had Dr. O on the show,
Hmm.
and I think the conversation went really well.
It was excellent. I
Yeah,
mean, he brought up so many of the issues that we see and we need to make our community aware of. And
right,
you know, when what Dr. O talks about, it's not just for our community, of course, that's our outreach, but we're also talking about other brown people and
mm-hmm,
people of other ethnicities that
right,
could benefit from what we just had a discussion about.
right, right. And the fact that, and asking the question when you look at who's dying from this,
Yeah,
right? I mean,
yes.
I'm saying black and white, but life isn't that simple,
No, it's
right?
not.
You have people who identify as white or who you would identify as white, but they have genetics that that descend from Africa.
That's
And
right.
if we're not looking at all that, we have the ability. Why aren't we digging deeper into how to help people,
And you know
right?
what's interesting about that? You go to the doctor, you fill out a 22-page, I'm exaggerating a little bit, but you know what I mean, 22-page introductory about yourself form where they want to know if your parents had this, and that, if your
Mhm.
grandparents ever had that, if your sister siblings ever had something.
Mhm.
And yet, here we are with standardized medicine as though one size fits all. Well, why are you asking me about my genetics if you're not interested in doing an individualized type of medicine for me, protocol for me?
Good question. Good
And
question.
we have to start thinking about these issues when we go to a doctor. Doctors are taught in school, but as Dr. O said, you have to know your own body.
Hmm.
You have to know what works in your body, whether it's food, medication, or what have you.
Right.
And only you have to know your own genetics if there's a possibility that something could have been passed down, or if there's a trigger to what has happened to you. Because what we do know is genetics makes up only 25% of what could happen to you. But if there's a trigger, then there you are.
Well,
You can,
25%, I mean, if you think about that, that's 75% of what can happen to you is trigger.
yeah,
I mean, that right there,
that's right.
you know what I mean?
That's
How
exactly
could we
what
be
you mean.
ignoring that 75%?
How are we ignoring that and we're overlooking that? But better yet, how is the medical establishment ignoring that for us as a people?
Right, right. That's a good question.
And with the complexities of our bodies and our own genetics, because here we are a cosmo blend of all types of races,
Hmm.
but with a dominant African race,
Hmm.
how are we being ignored whenever we go in for treatment?
Good question. That's a very good question.
And we have to start asking these questions. We can't just take the advice of a doctor. And as Dr. O says, well, we have Tuskegee, but we have a whole lot more since then, and even before then, of medical apartheid.
Right.
So, yes, there's a skepticism about going to the doctor and
Mhm.
about trusting what they say. You
Right.
just can't turn a switch on and say, just because you say it, I should believe it when I'm watching 73% of the patients who go in who are Black die from this virus.
Right. Right.
That's
And
alarming.
you can't even have a family member with you. So there's no witnesses, right?
No
We have
witness.
to trust that they're doing the right thing with our loved ones in there,
Yes, you do.
you
And you
know?
haven't seen a chart. I mean, the patient that's in there, if they're incubated, they don't know what's going on. They're fearful. All they want to do is feel better. What exactly is going on? Who's explaining what's going on? And have you typed the blood to find out if you can even do that? For instance, my mother can't take penicillin, but would a doctor know that if she just went in
Just in
distress?
there, right? Exactly. With no family member there,
Right.
right? How much of what's killing people is that?
And now those are the questions we must ask ourselves.
Right. Right.
So, how do we empower ourselves because we're not helpless? I think The first step would be to get over the fear of a virus. As Dr. O says, they've been here longer than we have.
Mm-hmm.
And we've been here not for thousands of years. People have been here much longer than that,
Right.
hundreds of thousands of years.
Right.
So, what's the first step to get over the fear of an unknown virus? They crop up all the time. And this is one virus among many when you look at the whole picture.
Right.
Can we develop herd immunity? Well, it's happening.
Right. It is happening. And they
And
don't
who?
want it to happen.
That's right.
Now, it slipped out of somebody's mouth that they don't, they're hoping we don't have herd immunity. Well, why not? That would solve the problem, wouldn't it?
It slipped out of Fauci's mouth. He said it, so I'm going to say he said it because he's
He
on
did.
video saying it.
He did. He sure did. And when you think about it, kids and babies are not dying of it. So by the time they get of age where they would die from it, they would have been exposed to it. And so we get general herd immunity now. This problem of the coronavirus is solved.
It's solved.
Those
Not
7
only
vaccines that Bill Gates is working on, there will be no need for them.
and we have to start thinking in larger terms.
Right,
Who decided that a vaccine was the be all cure all
right,
when we have a natural pharmacy?
right, right. We're being allowed to use a limited toolkit, right?
That's right.
Because
Very
the
limited.
toolkit there has to be profit, lots and lots of profit. If there's no profit, then they're going to find a profit. Even the hydrochloric, I keep saying it wrong. The
Hydroxychloroquine.
hydroxy, yeah. Even that, you hear them complaining about it because they don't make enough money from it. They want to come up with something new so that they can, charge you top dollar for it, even if it's more dangerous or if it doesn't work as well.
Well, it's generic. They can't patent it anymore. And so it's really inexpensive. Um, for me, a 90-day supply would be $10.
Mm,
So that's very inexpensive.
right,
And they can't make any money off of that.
right,
However, what we what we need to be aware of, what are the things that we can do to empower ourselves and take back our health into our own hands that doesn't involve so many pharmaceuticals.
good question.
So that's key for us. What will it take to keep us healthy?
Right. And
And as we were talking earlier, we can't, as the Surgeon General, try to generalize all of us.
Mhm.
You can't look at an entire race of people and say, well, you're socioeconomically depraved, your eating habits are poor, you smoke, you drink, when there are many of us who don't do that at all. And
Right.
you have people with what appears to be some of the best diets who can get sick from this condition
Mm-hmm. Mm-hmm.
because there is no specialized protocol to check us. And when you think that something as simple as a blood test can check for abnormalities that are genetic, why aren't we doing it across the board? I remember when my son and I first got the big genome panel. I've been here at the pioneer steps of this, and we got that huge genome panel. It took months to come back. It was 20 grand for each of us
Wow.
to
Wow.
have that test, and
Mm-hmm.
insurance paid for it. And the doctor had to justify it to even get it paid for by insurance. And I'm talking about this happened within the last 15 years. Now, genetic testing is as simple as a blood draw. That's how simple it is. You can have it back, in a week or two. You don't have to wait 8 months anymore. So why are we not doing that? Why hasn't someone decided that Black lives matter and they should be tested?
Right. Right. Exactly. Because this one size fit all stamp type medicine is being pushed right now, despite Like, think about it, even the protocols, right? That's what that is. That's a stamp. That's a one size fit all. I get 10
Protocol.
patients
Hmm.
and I follow the same protocol for all of them if they present with this condition or that condition.
That's
If
right.
I see this, I do this, 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 and this. That's how it works. But you might see this in 10 people, and that protocol may only work for 5 of them. The
That's right.
other 5, oh well, they died.
That's right.
Instead of actually looking and being a human being as a practitioner,
Hmm.
right? Because when you go to the doctor, I mean, they say, oh, you go into Google. Well, what's the difference,
Exactly. I can
right?
pull
If
up
the doctor's
WebMD.
if he's acting as if he's artificial intelligence, right? You
That's
program him what to do under what circumstance,
right.
and he just spits it out. If that's how medicine is being practiced, then that's not healing. That's
Well,
not
we're watching it right now.
right.
This protocol is a standard. They've developed a standard protocol in 3 weeks.
Right.
What is it? It's so many milligrams of hydroxychloroquine
Well,
along with
I don't even think that's everywhere. Some states aren't even allowing that. Like that had to be fought for,
yeah,
right? So every
right,
little thing has to be fought for, and then it's boom, stamp, one
right.
size fit all, right? And if it doesn't
Exactly.
fit you, and you happen to fall into that protocol,
You got it.
same thing with a vaccine, right? I mean,
That's
everybody has
right.
to be vaccinated. So if you happen to be one of those people that vaccine doesn't work for, oh well.
Exactly.
And
And if you're going to allow fear to drive you to get a vaccine, what are you running from? Viruses have been here, they will be here, there will always be a virus.
right,
So the best thing that you can do is shore up your body.
right, right. And get to know your body, pay attention to your body, take responsibility for your body. And what's occurring to me too? If there's one lesson in this, and I've got many,
Yeah.
just from this time period, but during this outbreak, if there's any lesson that has stood out to me the most, it's that living with chronic illness isn't okay.
No, it's not.
That the goal must always be health, right? Complete
Right.
health. Not I'm living with high blood pressure or I'm living with diabetes or I'm living with, run down a list. And I think as a society, we culturally begin to accept chronic illness as if it's a normal thing.
We do. And it's because many of us, once again, we don't have a decent detox pathway. It
Hmm.
is impaired.
Right.
And so there are people who can detox anything out. And
Hmm.
they can eat all the mercury fish that they want. They can drink water full of lead. For some reason, their bodies work beautifully. They detox it out. It never crosses the blood-brain barrier. But for the vast majority of us, that's not happening.
So you basically gave me an idea. You know how some people can drink, right, alcohol?
Yeah,
You'll sit 5 friends down and they'll have like a drinking party and one will die
yeah.
and they all drink the same amount,
But one
right?
died from alcohol poisoning. That's right.
Right. So I'm wondering, how deeply have we been asking questions in our society right now? And I'm not saying people should be drinking till they drop, because to me,
No,
that's just a silly practice that a lot of people have, especially a lot of young people. But I mean, we've always known that that tells you right there that not everybody can detox at the same rate.
that's right.
Just
And
that
some can't
alone tells
detox
you,
at all without help.
right. So, and that's why some people will tell you, I don't drink because I drink and I'm messed up for.
Well, it's like cannabis for me. I found out that I have a missing SNP panel in my. I have a missing enzyme in my SNP panel if I were to smoke cannabis, vape it, or even if I just took the oil and took too much, it could literally stop my heart.
Really?
But how would I have known that without genetic testing? This is what I'm saying. How would I have known that without genetic testing? And I remember when all of the youth in my day, because all the youth do something,
Hmm.
everybody was smoking weed. We called it weed back then, a pot.
Right. It smelled
I would,
different then too.
yeah,
It
it
smelled
is.
like
I
skunk.
would
Now I don't
walk
know
up.
what that is. I don't know
Well,
what these youngins smoking
I
now.
don't know what they're smoking out, but
Right.
that was the pure stuff back then. I would walk by it and get so sick until I wanted to throw up, just catching a whiff, smelling it in. So
Really?
I never used it. I just couldn't. And when I got some hemp oil one time, and poor me, they told me, well, there's no THC in the hemp oil. I said, oh, good. So it has some cinnamon in it. It tastes pretty darn good. So I took too much of it, and my heart ached. And I was
Wow.
talking to a friend of mine. I mean, it was so bad. I was walking around like this, thinking I had some pulmonary hypertension, a reaction from pulmonary hypertension because I have a mild form of it. And she looked at my genome and she said, "Oh no, here's the SNP panel right here. You can't you can't take any large amounts of cannabis. Actually, you should actually stay away from it because it can stop your heart."
So even the cannabis, as much as they're touting that now as being like the cure all and whatever, even that's not one. It may be wonderful for some people,
But not for
but
all.
not for everybody.
Not for everybody. I mean, even some natural things we all cannot have.
Right.
And we need to know our bodies. We need to know what we can have and what we can't have. I know for some of us who do have such serious inflammation, we need cooked foods. We need to keep the body warm instead of so many raw foods because the digestive tract isn't working as well as it should. I mean, there's just so much. And we're going to find out these things by knowing our bodies. How do you know your body? Trial and error. You keep a food diary. You have to look and see what made you sick for how many times or made you feel ill for how many times.
Mhm.
And let's start removing those things.
Right.
Just like the dairy. I was shocked to when I don't even know how I got there, but I just started. Well, actually, I do. I was watching this movie. That's how I got there. I was watching this movie. It was a Spanish movie, but it dealt with the Congo. And I'm watching it, I'm looking at the people, and I said, well, let me look this up because I do that all the time. I want to look up and see what's going on. I wanted to see if it was based on any historical presence or something like that. So I look it up, I'm looking up the people. And what do I come up when I'm reading this? That many in the Congo, the Benin, are lactose intolerant.
Mm.
It's right there. Lactose intolerant. So, how many of us? I mean, my husband and I grew up in different states.
Mm-hmm.
You know, we're both African American, Black indigenous people. His whole family's lactose intolerant, protein intolerant. My family is too.
I
So there's a you can try to get around your ancestry, your genetics. You can't.
Right. And even the people who think they're not lactose intolerant, but you eat dairy and you develop mucus. What's that?
What's that? Well, found out with my babies, they were protein intolerant. So, you know, we've always done the gluten-free, dairy-free
Right.
because we can't tolerate gluten. We cannot tolerate it.
So what
And
symptoms do you have if you eat the protein of dairy? Like how do you know like how does that express in you?
it expresses immediately with painful gas, diarrhea,
Mhm.
indigestion, all these things. And then people are grabbing Xanax became so popular because people were trying to eat dairy. So they take a Xanax to calm it down. No, eliminate the food that's causing the fire within you.
Causing no problem, right? Exactly.
Just
Well, that's the same
eliminate
thing with the mucus, right? Because remember,
yeah,
Dr. O was talking about that your body, your immune system will basically launch an attack against an antigen, and an antigen can be a protein.
that's right.
So if protein doesn't agree with you, and your immune system is launching an attack, that just went off of my head when he was talking.
Mhm.
then that mucus that you're noticing is your immune system
That's right.
launching an attack against the dairy that you're eating and enjoying, the pizza and all that stuff,
Right. That's no
right?
good
And
for you.
so, right. So when you come across something like COVID, your immune system is already fighting your diet, and now it's got to fight this virus too.
So
And you've
you're
already
already
got all this
compromised.
mucus in
That's right.
there because it's fighting it, right? So you
Yeah.
can see how that could end not so well, or you could end up having a harder time
Right.
with that virus or any of the other plethora. I mean, we're talking about COVID, but I mean, there's a bunch of, I'm like, there's been like every other year something nasty comes out.
Every other year. And there
Yeah,
you are. You're still trying to eat what you enjoy. I heard someone with lupus say, um, his wife told him, listen, I would like for you to go plant-based. Let's just try it. Let's clean up your diet. No, I'm eating the diet of my people and I'm going to enjoy it. And I'm thinking to myself, do you even know the diet of your
I
people?
know.
No, you know the
Yeah,
diet that was handed down from what the slaves had left to eat, the scraps. But
right.
that's not the diet of your people.
No. Mm-mm.
You got to go back to Africa to find out the diet of your people,
Right,
the different nations that you might encompass in Africa to find out the diet of your people.
right,
That diet started here from the scraps.
right.
And just because you like the flavor, we eat to live. We don't live to eat. And I think people have that twisted.
Right. Right. Humans are adaptable, and I think our
Mhm.
adaptability is going against us now. We're
I think it
adapted to
is.
chronic illness. We're adapting to our children being sicker, we being sicker, and our
Right.
children being developmentally disabled. We're adapting to it,
We're adapting to it.
right?
Intellectually disabled, physically disabled. No
Mhm.
one thinks anything of a child with asthma. That's not normal.
No, no,
Eczema. That's not normal.
it's not normal. We're adapting to it though. We
Right.
adapted to the diets that our ancestors adapted to the diets they had to. They had to do that to survive, but it wasn't an adaptation. It wasn't ideal. And once the condition was removed, then we should have gone back
That's
to
right.
our regular diet. And even then, I think they knew it wasn't. They knew that it was an adaptation. That's why they use certain herbs and cook things a certain way to try to
Right.
survive.
And you know what's beautiful about our bodies? It regenerates itself.
Mhm.
The liver in 90 days. I mean, the body really is remarkable
It is remarkable.
if you give it what it needs. And and you stop with the fear mongering.
Right,
That is more detrimental and brings out more stress than anything.
right. It does.
It really does.
Yeah,
I I really enjoyed our conversation today with Dr.
me
O.
too. Yeah,
I did. And I'm looking forward to our next conversation with
me
him.
too. Me too. So again, if you guys have questions for Dr. O or questions for us, or even, people you'd like us to interview,
Yeah.
questions you would like for us to look into and answer, let us know. Put it in the comments. Shoot us a message. We'd like to know what you think.